wanted to follow up on this story, which is still very much in the news. The great news yesterday, we found out just after 3 o'clock that the little 3-year-old girl, the one who had been reported missing, of course, on Sunday, had been found alive and well, safe and sound, and in hospital now. A lot of questions here, of course. But beyond the questions of how we got to this place is the idea, and the one that really needs to be followed up on right now. This is a 3-year-old child who spent 4 days on her own, found standing beside a highway yesterday in Castleman, Ontario. Question now becomes, outside of, her health, and we're told, as I said, she's okay, what's next for her having to deal with now being abandoned as a 3-year-old? Dr. Samantha Goldwater-Adler is a Montreal clinical psychologist specializing in child psychology and cognitive behavioral therapy, and she is on the line. Dr. Goldwater, thank you so much for the time this afternoon. I'm not sure beyond what's next, what the next question here should be. So what has to happen as far as this little girl is concerned next? What will happen?
That's a great question, and hopefully, we're obviously really glad that she was found safe and sound, and hopefully because this has gotten so much media attention, then she's going to get a lot of the really concerned people around her, giving her the care that she needs. Obviously, this is a traumatic and terrifying experience for anybody, and particularly for a 3-year-old. What's going to be really important right now is that the adults around her, and particularly when she's reunited with her primary caregivers, that they respond in a calm, present, consistent, and emotionally attuned way, and that they're looking out for signs to see how she's adapting, giving her care when she needs, and also helping her to develop a narrative to understand what the heck just happened to her. Because for now, it must be completely baffling and confusing for her trying to piece this all together. And her ability to be able to put this together into a story that makes sense, and particularly not to blame herself and to still be able to feel safe in her world, is going to be really imperative for her right now to be able to prevent some longer-term potential harms.
I've heard people speculating as to, how this is going to play out and saying, well, she's only 3, she'll forget about this. It's just something that, in a week from now, she won't even remember. There's the issue, though, a couple of issues here. One is the trust factor, right? We know her mom told her when she was found yesterday, just stay here and wait for your mom, which is apparently what she did. But then there's the trust issue. Mom never came back. Mm-hmm. How does that get dealt with?
It's huge. And yes, she's a little kid. And of course, people are resilient and kids are resilient. But in the first 5 years of life, that's a critical developmental period. And that's where certain adverse events, particularly if there's multiple ones, are going to potentially hit harder and kind of ripple through development, because that's where we're really developing our sense of self. As you're saying, it's developing our sense of trust, right? When we're little kids, we're learning to understand the world. We're learning to understand who we are, how other people are going to treat us, if we're worthy, if people are trustworthy, if the world is safe, if people are going to be there to take care of us when we need them. And so having been abandoned in that way at such a young age is terrifying and obviously really destabilizing. And there's going to be a lot of work for this little girl to be able to rebuild that sense of trust for her and that sense of safety in relationships and that sense of worthiness. And of course, physically being able to help her to regulate and calm down from that major stress reaction that she must have been going through. Going to take a lot of patience, time, and loving care and support for this little girl.
And of course, at the same time, we know her mother is facing, a bail hearing, I think actually tomorrow, and she's not going to see her mother, I would guess, for quite some time. This is the only person who's basically, from what I can tell, been involved in her life. How traumatic is that?
It's huge. It's really sad for this kid because, the person that she was presumably the closest with abandoned her, and now she may get even the secondary abandonment, because now that even she's back and she's found, she may not get to see her mom for a while. And of course, we don't know, there's so many things that are unknown right now. We don't know what, this kid's life was like before being abandoned in the woods. And hopefully it was safe and okay, but, it doesn't look great given what happened to her. And when we're looking in terms of the research, what it shows is that, again, that those first 5 years are a critical period, and where the, one traumatic period or one difficult thing is, obviously difficult for anybody, and this would be a huge one, but where we really see the higher risk for long-term kind of emotional and physical and relational difficulties comes when there's an accumulation of adverse childhood events, and potentially being separated by a caregiver, this abandonment. We don't know if her mom had mental health issues or addiction issues. We don't know. The thing that I'm really hopeful for this little girl is that, again, there's been this outpouring of love and support from the community, and hopefully she really gets, some caring adults and maybe other family members to come in and really provide her with that stability and that support that she really needs to be able to process and get through this.
I wonder, though, with the help she's going to need, the psychiatric help, the therapy, if you will, here, we know that, historically in this province, that's difficult to get in the best of times. How does the public system get involved here, and can they carry this all the way through? Because who knows what the means of the family are here.
That's a good point, and that's going to be the question, right? And hopefully with the media attention that's been involved, and there's going to be more pressure to be able to get her the care and support she needs. In the public system, yes, it's really underfunded and underserved, and that's a huge problem. And the people who work in the public system are still, really well-meaning and are doing the best that they possibly can. And I'm sure that whatever services that are possible to be available to her are going to be made available to her. And people are going to go in, the people that are working in the public system or in the private system, if there's resources, are going to do the best that they possibly can. And of course, there's all the importance of, psychological care and, counseling, psychiatric care, all these things, but also just the well-meaning adults in her environment. So if she has loving people in the community and family that can provide her with some level of, or other family members that can give her some level of stability, rebuild that trust and those attachment relationships, and really support her during this period as her little nervous system is trying to kind of calm down and regain some sense of normalcy, that would really go a long way.
I just want to ask one last question, which I was thinking earlier on, maybe the best way, and again, I have no idea what goes through the brain of a 3-year-old, but having been through this, and now, she's got all these people around her who are smiling, and she's happy again, and, she's getting food and everything she wants to, and they're trying to make it seem, of course, like nothing terrible happened. Is that the right approach here? Because I know that's the thing we'd want to do right away. We want to make her feel better. We want to see her smile. Is that okay?
I love this question, Aaron, and you're absolutely right. Obviously, we want to give her a sense of safety and give her some comfort and some her old plushies in her bed and love and support and food. But she's also we can't pretend that nothing happened to her. She went through something really messed up that, frankly, for you and I as adults, if we went through that, we'd be having a really rough time. Yeah. And she's just 3. And so we can't pretend that it doesn't happen. She's going to need some narrative support here. So again, to help make sense of what happened, someone who's going to be able to sit with some of those big feelings that she has, help her put words to those feelings and those experiences, and be able to, particularly when we go into threat mode, particularly as little kids, experiences get kind of jumbled. It just becomes a sort of scattering of events and sensations, and it often doesn't make much sense. And that's what can kind of contribute to the nervous system staying stuck in trauma mode and survival mode. So she's going to need some help to understand her feelings, understand what happened, the story, in age-appropriate terms, of course, and be able to really importantly, not have somebody give her the message that it wasn't her fault.
Okay. It's a long road here from what I'm sensing. Doctor, I want to thank you so much for the time. Very much appreciate it.
My pleasure.
Dr. Samantha Goldwater-Adler on the little 3-year-old, and wishing her, of course, all the best, or as they said in the Journal today, wishing her le Québec, wishing her all the best.